Hello, I'm Michelle Levander, Director of the USC Center for Health Journalism. Thanks for joining us today, and welcome to our Health Matters webinar covering coronavirus, what the data tells us. One of the most daunting elements of reporting on the coronavirus epidemic has been getting a firm fix on its scale, both nationally and in our communities. Reporters we've surveyed have asked us to provide tools and ways to tackle deeper coverage that goes beyond breaking news. We've seen some central questions emerge, and we want to help you to answer them. In this webinar, we'll provide you with ways to better map the impact of COVID-19 and to answer questions on the infrastructure needed to survive it and the people most vulnerable to it. Kaiser Health News data editor Liz Lucas will walk us through the data sources on case counts, deaths, and demographics, on hard-hit nursing homes and on hospitals. We'll also look at sources on the most vulnerable populations, looking at what data can be found on race and ethnicity, the poor, those with inadequate housing, and those with pre-existing conditions. Before we get started, let me share a little bit more on our featured speaker. Liz Lucas is the data editor for Kaiser Health News, where she specializes in data analysis and reporting for the Kaiser Health News Enterprise team. Please join me in congratulating her, as she and a colleague were just named finalists for the 2020 Pulitzer Prize in Investigative Journalism. Her reporting exposed predatory billing practices by the University of Virginia Health System. She came to Kaiser Health News from investigative reporters and editors, where she spent 4 years training and supporting data journalists around the world as the NICAR Data Library Director. Previously, she worked as a data reporter on health and the environment for the Center for Public Integrity. She has a master's degree from the Missouri School of Journalism. This webinar is offered thanks to the generous support of the National Institute for Healthcare Management Foundation and the Commonwealth Fund. You can tweet about the webinar at the hashtag coronavirus. A word about our format today. We'll be hearing from our panelists first, and then we'll turn it over to our audience for questions. Because we have so many people on the call, we'll ask you to write your questions into the control panel of GoToWebinar. You can also write us there if you're experiencing technical problems. Now, let's turn to Liz.
Thank you so much for that introduction, Michelle. And I just want to say a big thanks to you and all the folks at the Center for Health Journalism for doing stuff like this. These webinars available to the journalism public are just such a great resource. And as I was preparing for this one, I actually turned to some previous webinars and some webinars done by other journalism organizations. And at the end of this, I'll talk about some places to look for more resources. There's such a great movement of sharing resources and sharing information in the journalism community that I've always appreciated. The Center for Health Journalism is a part of that, and IRE is a part of that. And gosh, as journalists, we just have so many good opportunities to learn new things, and I hope to be a part of that today. So as Michelle mentioned, I want to go through some, certainly not all, but some of the best data resources for covering the pandemic and COVID-19. We have been at this pandemic for 3 months now, give or take, I guess depending on when it truly started. And despite some prominent political messaging, it's not almost over. We have to continue covering this thing. And as our understanding of the disease grows, and many people are probably feeling coronavirus coverage fatigue. I know that I am. I'm sure many of you are. I'm sure some of our readers are. Nevertheless, it's our job to continue covering the pandemic and the disease in the best way that we possibly can. And so one of the good things is that now, as opposed to at the early stages of this disease, we have a lot more data. It's sort of an unfortunate thing as cases have risen and hospitalizations have risen, we're gathering more and more data, but that does sort of make our burden of covering this a little bit easier. Now, granted, there's good data and there's bad data, and it can be very difficult to tell which is which. And then no data is any good without the appropriate context. So that's something I want to talk a lot about today also. for some areas of this pandemic, particularly the case counts, we're now kind of inundated with data. And it's really incumbent upon us to use that data responsibly and communicate with our readers and viewers and listeners responsibly. So I will talk about that a little bit. In thinking about, how we continue to cover coronavirus, I came up with this list of questions, which really are not very different than the list of questions I would have had in February or early March. The good thing is that now, again, we have some additional resources to cover some of these questions. So I'll just read them off here, and it's kind of a roadmap for the different data sets I want to talk about today. How many people are sick, right? That old case count question. And we have to remember always when we're talking about this topic that this does not equal, in terms of data anyway, how many people have COVID-19. Because as we've come to know, a lot of people have the disease that we don't know that they have it. They're asymptomatic. And so how many people are sick is sort of a proxy for that bigger question of how many people actually have COVID-19. And that question we probably won't be able to answer for quite some time. How many people have died? That's another really important one. And it's not as simple as you might think answering that question, and we'll get into that. How much testing is happening? I'm going to harp a lot on testing. It's really the linchpin for figuring out how to get ourselves out of this pandemic. Who are the most vulnerable? Who are neglected? Those asking and answering those questions is always the responsibility of good journalism. Who's not getting the attention they deserve? Who is being the hardest hit? And so we'll get into some really good resources for covering that, particularly on a local level. There's been some really good national reporting around a lot of these topics, and there's a lot of local and regional reporting to be done. So we'll talk about how to drill down and get to the local level. And then, of course, that question that you can't ignore if you're going to have a webinar on COVID-19, which is how do we get out of this? And we'll talk about that at the end. So let's get started on this question. These questions. How many people are sick and how many people have died? Well, I want to start by showing you this graphic, which is something that I was sitting with my girlfriend at the kitchen table today, and she was looking at a local newsroom website. And this graphic was on a page, I think with another graphic, maybe a map, but without a lot of explanation, and there was no story attached to it. It was just this particular newsroom's COVID case tracker. And I'm in Missouri currently, so these are Missouri changes in state case and death totals. And I warrant most of you have seen one of these charts or perhaps created one of these charts. And this chart in and of itself it's not that the data is incorrect or even that the chart is unhelpful, but she's a fairly well-read person, but she's not a journalist. And Missouri is in the process of reopening right now. And, if you follow the news at all, again, I'm thinking of lay people, if they follow the news at all, they know that we're waiting for the curve to flatten in order to reopen. And yet we're reopening and this does not look like a flat curve. And so she turns to me and she says, I have no idea what to make of this. And I think that's indicative of a sort of a shortcoming on our part. Certainly not everybody, there's a lot of good work out there to put this in context, but I guess the point I'm trying to make is we really need to put a lot of this information in context and really help people understand what it means that yesterday there was a spike in over 350 new cases in the state of Missouri. So I want to talk a little bit about how to do that and also just where to get the best information about case counts. So I came across this article by the Upshot at the New York Times a few days ago. And I think this is not necessarily a data source, but a really good kind of clinic on how to look at case counts and how to put them in context, right? Again, context is really the key. And they talk about 5 different ways to follow the coronavirus outbreak for any metro area in the US. So I want to talk about these pretty quickly. One is this, which is what we were just looking at, right? New case and deaths per day. Tell a particular story about what's happening with the curve in a particular state, right? And they actually, this is great because they let you look for your particular area and see where it falls. But here, this is another way to look at this information, is comparing case counts in a particular area to in the last 2 weeks. And this shows the really useful per 1,000 people metric here. So something we didn't see a lot of early on, especially as we were all zoned in to that Johns Hopkins map, was normalizing this data by population, right? We were looking at pure case counts. And again, not that that's necessarily bad or doesn't have its own merit, but if you're looking at areas that are seeing spikes or wanting to assess what the trend is, you really need to normalize the data by looking at it per population. And so this is just cases per population in the last 2 weeks, right? So it's comparing these metro areas. And then if you scroll down a little further, here's another way to look at it, which is what's happening with the cases. How often are they doubling, right? What's the growth rate over the last 2 weeks? So that tells us a different story about case counts. And then here's where there may be good news ahead, where there's a change per 100,000 people for the last 2 weeks. So I just wanted to show you this resource just to say, think about how you're trying to convey what's happening in your area, and it's particularly if you're trying to compare two areas within your state or to compare two states in your coverage area. Think about how you can normalize the data and just add that little bit of extra context to really help people be able to understand what it means that there may have been a huge spike, or that new cases, maybe there's hundreds of new cases every day, but that's less than there was 2 weeks ago. And so providing that context is so critical. One of the things I will say about this, which the New York Times made this decision to look at this data by metro area, which is a really useful tool for comparing, allowing people to look up their city, but it does exclude rural areas. And it's really important for reporters, particularly who have rural areas in their coverage zones, to not forget that rural areas are also experiencing COVID-19, and we have to report on them. So like I said, that I thought was a good summary of the different ways you can use case counts. But in terms of actually getting the data, I would suggest one of the best, most reliable sources is also the New York Times. They have this page where you can download case counts on a daily basis by county or by state. And I wanted to look at this one because it's posted on a GitHub page. Now, some of you may use GitHub, some of you may know of it and have gotten data from it before, and some of you may have never heard of it and feel daunted by a GitHub page like this. So just as I'm not going to get into what GitHub is, but it is a place where newsrooms can and often do post data or analysis that they're willing to share. And so this is how the New York Times shares their data. So if you go to the main GitHub page for their COVID-19 data, you'll see all this stuff here, which you don't have to necessarily worry about. If you go down, there's often this thing called a README, which sort of lays out the data. And there's a couple things I want to point out here. You can download as a CSV the US data, the state level data, or the county level data. And each one of these CSVs has a row for each day that there are cases reported. And so you can look at, for each county in your area, you can look at the total number of cases and the total number of deaths on each day, going back, I think, into February or even January. Oh, look, it says down here, January 21. And another thing I want to point out about this, if you're on GitHub or really any page where you're downloading data, you always want to read the information that they're trying to give you about their data. So if you scroll down and you read about this, you will see, this is an important, there's a methodology and definition section down here, which tells you that the New York Times deals with some counties kind of in a different way. For example, they take New York, they take all 5 boroughs or counties of New York, and assign them to a single area called New York City. So if you're looking for just the Bronx, you're not going to find that in this data. So this kind of thing, you have to make sure that you're reading any methodology or definitions they give you so that you can catch those kinds of things before you do your analysis. But the New York Times updates this data every morning with yesterday's data. So it's a really good place to go and try and get up-to-date case counts, particularly if you're wanting to do a comparison of different counties or different states in the US. I wanted to bring up also the LA Times is doing its own coronavirus tracking in California specifically. And in some cases, I think the LA Times has zip code data available for certain parts of California. And I just wanted to bring this up. It's kind of considered to be the go-to source for California information. And also just to give a shout out to the journalists that have become the go-to source of case counts when state and county officials have not been reliably collecting or disseminating this information, at least not on a nationwide level. The effort that journalists have put in to collect and curate and share data for free has really been amazing during the pandemic. And a lot of the sources that I'll highlight, you'll see, are actually from journalists. And so this is another one, a shout out to the LA Times. Before we get to that, actually, I'm going to skip ahead here. I want to talk a little bit, though. I've given you some resources for getting data on the national level. And those resources are really good for, again, if you want to do a national analysis. However, if you're doing local reporting or county reporting, it's absolutely worth going to see if your local district or county or health department, or even your state one, has some of this information. If you think about how cases are identified and collected, it's happening at the ground level, and then it's reported up to probably the local public health department. You know, it depends in each state how it functions. But all that information has to filter up, right? So the closer you can get to the ground level of where things are happening, the more recent your data will be. And for some of these places here, let's take a look at Shelby County, Tennessee is one we used in a story recently, and so I wanted to highlight it. I said earlier that, you know, this information isn't being collected and disseminated widely, and it is to some degree by some local health departments, but in terms of government agencies collecting and disseminating it, it's been a little bit slow, which is why journalists have stepped in. But here we have actually the Shelby County, Tennessee Health Department does a pretty good job of providing case counts, and they break this information down really critically by demographics. If you scroll down here a little bit, you can see the case counts by age as of 5/5, that's yesterday. You can see the case counts by sex, and you can see the case counts by race and ethnicity. You know, they're kind of rough categories, but this is something that for a long time we did not have access to, this demographic breakdown of COVID case counts. The fact that some public health departments are now able to report it and are reporting it up, there's an effort at the CDC to collect this information, is a really good sign. I will say it's early on, and so one thing you have to make note of here, you'll see it's really nice that they put this in here, but they say missing unknown. They tell you that about a fifth to a quarter of cases in Shelby County, Tennessee, they don't know the race. So that doesn't mean that you can't report on this, but that you have to make sure you know what you're missing. And with some of this stuff, aside from just the pure case counts, you are going to be missing some information. So take note of that. For race and ethnicity, it's a little bit higher than, say, for sex. You'll see it's just about 2% and even less when you get down to age. So be aware of how reliable some of this data is. But a lot of, again, a lot of public health departments are at least headed in this direction. And I've listed a few here. Boone County is the one where I live. They all kind of look a little bit different. But I think a lot of places are moving towards having these dashboards. So check to see if your city or county public health department, or even your state public health department, has something like this dashboard that shows a breakdown of cases. As we've read in some news articles, we're beginning to see a trend where Blacks or African Americans are more adversely affected, are bearing a heavier load of both the caseloads and the deaths in a bunch of different places. And we don't know the extent of that yet, again, because this reporting has been so slow. One of the things that I like that Boone County does here is they give you both the percentage of cases, and then they compare it to the percent of the general population, which again is just a little bit of extra context that helps you understand. And Boone County is very white, as you can tell, it's 80% white, but the white population has a disproportionately less percentage. I mean, it's a little bit, but a disproportionate less percentage of the cases. And you can see that Blacks are, in fact, have a greater percentage than their percentage of the population. So that, that kind of normalizing factor is a really good thing to add if you're trying to look into this. The other thing that's becoming more available as we go is data by zip code. And the more that that's reported, the better we'll be able to do that analysis or that reporting on how vulnerable communities and minority communities are being harder hit. So this is a really good thing we're moving towards. It's not very widespread yet. Here you have Illinois has some data by zip code, but I think it's not 100% just yet. But then you can search different zip codes, which is a really good and useful thing. And then also another thing that you can look for on these local sites is the hospitalizations, which gives you a sense of how many people are currently being hospitalized. It's an important thing to track, again, as we're sort of shifting into reopening our local and state economies. Well, I guess Maryland's site is a little bit slow, but I'll just tell you that they are reporting the number of current hospitalizations, which is a useful metric to look at. So I would encourage you to try and find some of this information locally. And I want to go back here to this slide to talk a little bit about deaths also. Obviously, we have been paying a lot of attention to the death counts, which are publicized every day and continue to climb. There have been some good stories recently looking at, I think the first one that I saw was out of New York City, looking at what we call provisional deaths, or the number of deaths that have happened in the last couple of months that are sort of above the yearly average, but aren't technically identified as COVID deaths. So if you look at this really neat chart here, what the Washington Post did was they took this data on provisional deaths. So there's this average seasonal trend of deaths from years past. And for the last couple of months, for the last couple of weeks, we are way over the average. But only part of that increase is explained and attributed to COVID-19. So this kind of gets at that question of, well, how good is our data, right? We have these, daily death counts, but I think what the CDC data is trying to have a conversation about, and what the Washington Post is covering, is that there's a whole lot of deaths out there that aren't actually being attributed to COVID, even though they likely are related to COVID. And so this is something that's going to continue to develop as death counts continue to mount. And this is a really good topic for local and regional coverage. And I think the way to get at it, you can definitely look at this. The CDC releases this provisional death data on a state basis. And they do it by week, which is great. They do note that there's like a 1 to 8 week lag based on how long it takes some states to report death data. Getting death certificates and collecting that information, it moves up the pipeline really slowly. So this is another one of those situations where I think if you can go to your medical examiner or whoever is tallying these deaths at the local level, you can get just an aggregate death count by week, or by month even, and then look at past averages and see how high that death count is and compare that to both past averages and then how much of that is attributed to COVID. So one of the things we're finding, even as we have all of this additional data, it has some real weaknesses. One thing I want to point out about even just the case counts, it matters very much who is being tested, right? So for a long time, New York City was only testing people who were hospitalized because they didn't have enough tests to cover everybody who's tested. And that was true for a lot of other places as well. So the death rate in New York City looks really high, in part because they weren't able to test a huge part of the population that was most likely sick but didn't need to be hospitalized. And we wrote a story at one point about a number of people who were sick in various places and went to get tested, and basically they were told there wasn't enough testing to test them, but they should just presume that they had COVID-19. And I think that's probably true in a lot of areas. So just because we have case counts, just because we know how many people have tested positive, again, does not mean that we know how many people have COVID-19. And it also makes it can make it difficult to compare. So it's really important to ask who is being tested and who's eligible to be tested in your area. And especially as we start to reopen economies and businesses, having a broader testing is a key part of that. And so is that happening? And we're going to get to the kind of the questions we need to ask about a reopening economy pretty soon. But I wanted to also mention Census Reporter here, because I've talked a lot about contextualizing data and normalizing it, and that really is about using denominators. So instead of just reporting a total case count, looking at cases per 100,000 people. And you can do that. You can, if you're getting case counts broken down by race or by age, you can also get the denominators in your area by race or by age from the census. And certainly you can use the census's website, but some data journalists actually created Census Reporter, and it's a really easy, good place to quickly get census data. So the example I want to show you is I was looking at Shelby County, Tennessee earlier, right? So we saw case counts, and they were broken down by race, and they were broken down by age. So if I plug Shelby County in here, automatically the Census Reporter gives me this really valuable demographics. So it gives me population by age range, it gives me race and ethnicity data, it gives me per capita income and median household income, and all of these metrics, persons below the poverty line, all of these things, a lot of these things go into risk for COVID, and we'll talk about that here in just a minute. But I wanted just to show you this resource because they make it very easy to download this data. So if I, for example, want to look at what age groups are being disproportionately affected by COVID, I can get that case counts from my local county, from Shelby County, which is not mine, but I could get the case counts from Shelby County and then go to show data here and then view data table. And from here, it will give you all of this information and you can download the data to a CSV or to Excel. So this is just a really quick and easy way to get some of this basic demographic information on various geographies. So that's censusreporter.org. And obviously I'll all have access to these slides after the presentation, and there are links galore in here. I think I've already harped on testing quite a lot, but here's kind of the best, again, this is the best national source that I know about to track testing. It's the Kovach Tracking project, which was started by the Atlantic and is, I believe a lot of different organizations are now participating in using this. And they do the best job that they can to track testing. And other than looking at some local or regional resources like your public health department, I think this is probably the best place to go if you want a broad overview. And again, I would say it's really important to read the documentation about this, the how to use it tab here. So this talks about their sources. It mentions that early on, this data was actually pretty inconsistent. but things have gotten a lot better and people are reporting it a lot more consistently, and so they have a lot more confidence in what's being reported, except when it comes to hospitalizations, ICU status, deaths. They say that's less consistently reported, and so they don't even include it anymore. They also give states data quality grades, so you can see how good your state is doing at reporting some of this stuff. But this is a good place, you can look at it here in a minute, in a spreadsheet form. This is a good place to get a sense of a broad view of testing that's happening on the state level. So yeah, take time to check that out. I would again, though, encourage you to look locally, and also to mention, you know, the CDC has some numbers on testing, and they're very upfront about the fact that they're looking at CDC labs and US public health laboratories, but that's not the whole story about testing, because hospitals and private labs and commercial labs are also doing testing. And they're not always communicating with public officials about how much testing they're doing or how much capacity they have to test. And I learned this yesterday, actually, as I was listening to a city council meeting here in Columbia, and the deputy public health official was saying that they couldn't get the hospitals to tell them what their testing capacity was. And they gave some vague numbers about what they were aiming for. So that's an issue when you don't have good communication between your providers and your public health departments, something to keep in mind. But also just make sure when you're looking at testing numbers, you're capturing all labs, you know where testing is being done in your area. Sometimes it's mostly in public health labs, sometimes it's mostly commercial labs. So just to be aware that there's these different ways that testing can happen. But it really is just a critical thing to be looking at and asking questions about. How many people are we testing? Who can get tested? Again, as we reopen. So this question about the vulnerable and the neglected, you could do a whole webinar, and maybe this center will do one. I want to just touch briefly on a few resources that I think are really valuable, and you can do your own digging too, but this really is just a key part of coverage that we need to be thinking about, is who's being unfairly and disproportionately affected. And a lot of it has to do with social determinants. You know, if you can't wash your hands because your house doesn't have adequate plumbing, if you can't isolate because you have a house where you have more people than there are rooms in your house, if you have pre-existing conditions, if you have to go to work because you're the sole money earner in your household, right? These are all things that negatively affect your ability to cope if you're going to get sick. And so we are going to continue to see a greater burden of this disease borne by people who are the most vulnerable. So continuing to cover that and watch that is really important reporting. And the first thing I'll mention here, which is just a great kind of background resource, is the CDC's Social Vulnerability Index, which I didn't know about until I went to a webinar early on in the pandemic. But the CDC has this, they create this index for census tracts about how resilient they are when confronted by external stresses on human health, such as natural or human-caused disasters or disease outbreaks. Those database is a really good thing to consult right now. I think the difficulty with it is, A, census tract is not really geography that's understood by your readers or your listeners or your viewers, and B, it's hard to talk about the Social Vulnerability Index. So it's more of a reporting tool than it is something you want to plug into your story. But you can go to the CDC's website and explore this, and they'll give you a social vulnerability index between 0, which is the lowest vulnerability, and 1. And here are all the things that they take into account. And you can get into this data and look at these different metrics and figure out which things are driving the vulnerability status in your area. And I don't have time to show all of that now, but here, I mean, this is just a really good list of the things that are most likely going to affect you negatively if you have to cope with being sick or staying at home, or all the things that come with being in this pandemic. So think about how you can report on these things in particular. And the SVI is a really good resource for that. And you know, the CDC, we've mentioned race and ethnicity already. I came across this data source recently of people who are tracking which states are publicly reporting COVID cases by race. So this is a good resource if you want to know right off the bat whether your state is reporting it by race or which states are. Again, that this doesn't, for some places it has like LA County, but it doesn't have a local county. So you want to investigate that on your own as well. Yeah, look for that local data. If you can get it, it's probably going to be your best bet. And then I have a couple of stories here that have done something like this. And in both cases, the reporters have written story recipes about how to do that story in your area. The first one here by Jamie Frazier from USA Today did one, and it looked at these data sources: federally qualified health centers and free and charitable clinics in medically underserved areas. And so if you follow this link to the Open News articles, Jamie gives you like a step-by-step of exactly how she did this analysis. So it's a really good recipe to redo this kind of story in your own area. And then my colleague Hannah Recht at KHN did one similarly, just looking at different factors. She looked at uninsurance rates and number of people below the poverty line and some other things. And we actually have this data available for download by county on our website. So if, you know, you can use Census Reporter for this, but you could also go to this page, and somewhere here is a data download. That will quickly tell you like the racial breakdown, the number of people over 65 per county, the number of people who are uninsured, the number of people who are living in poverty. And again, this is just, I'll say it again, this is context you can bring into your reporting to really break down those case counts of those deaths and see who's being adversely affected. I'll do a quick hit here on some institutional resources. There's been a lot of, it was kind of a focus in the first month or two of the pandemic was hospitals. You know, we saw a lot of reporting on hospitals. How many beds do they have? Do they have ICU beds? I myself did a story looking at that. And that story has changed quite a bit in some areas in particular, because hospitals have really tried to ramp up their ICU beds or their hospital beds, and there are, you know, auxiliary facilities were tasked to create beds for patients. So unfortunately, there isn't a really up-to-date resource for looking at hospital beds, except what's being reported directly by hospitals, and most likely that will be in your local public health department data based on hospitalizations and capacity. There's not a really good national source for us to track what's happening currently. And the story that I did on ICU beds was based on, you know, like year-old data that had been reported by hospitals to the Centers for Medicare and Medicaid Services. But that said, that information is still valuable to look at. It does give you some sense of what normal hospital capacity is. And Jacob Fenton, who used to work for the Sunlight Foundation and is now freelancer, put together, again, here we are with GitHub, put together this resource for accessing the hospital cost reports as a CSV. He's got a bunch of information here, so I would really recommend, if this is something you want to report on, this is a really good resource, because I had to use the original cost report data from CMS, and it's a nightmare. And this is a nice cleaned up version. And he also has some information on nursing homes. And nursing homes, you know, have been spotlighted for sure in a number of stories, and there's just still more reporting to do there, I think. Nursing homes have been just had a target on their back with this illness. And very helpfully, the Washington Post has started compiling cases of nursing home cases. And this is going to be a little incomplete because not all nursing homes are quite reporting yet. The CDC has said that they have to report, CMS has said that they do have to report the cases, and I think that's slowly starting to happen, so it's definitely something to watch. And I think the question of whether nursing homes are being tested is also a really good one. I know they're not being tested standardly in Missouri, but I don't know what's happening in other states. So these are some good resources for you to cover both nursing homes and hospitals. And the question, I'm running out of time if we're going to have time for your questions, but this is a really big question. How do we get out of this? And this is an article that my coworker Anna Barry Jester wrote about how do we exit the shutdown. And her answer was hire an army of public health workers. And your public health departments are really going to be critical as we move forward and reopen economies. And you know, I know there's a national plan for how to reopen, and there are a bunch of state plans, and I'm sure some local places also have their own plans. And they're probably going to differ a little bit. You know, they may lean on some of the same metrics, like a 14-day decline in cases, a 14-day decline in hospitalizations, a certain percentage of tests that come back negative. But it's really, I think, my sense is that we have plans. I'm not sure that they're being followed by everybody as closely as they ought to be. And so I think that is going to be a really important part of our responsibility over the coming months and into the fall, honestly. What is the plan that your local health department or local city council or state has put into place? Are they following it? If you can, talk to public health department workers and ask them, do they have the capacity to be able to handle, you know, to follow the plan? Are the metrics being met? How many contact tracers do we have? I mean, that's essentially a huge part of the containment, is tracking everybody who has the disease and quarantining them. So does your public health department have the capacity? Another thing I would ask public health departments is, what did they used to do that they can't do now because they are completely swamped with coronavirus? You know, public health departments play a lot of variable roles in our communities and are largely neglected. There have started to be some stories. I saw one out of the Sacramento Bee, and there was one in the Post and Courier Journal out of South Carolina. But we need to be doing a lot more reporting on our public health departments because they're critical. And here I've got some questions you can ask your public health department, and a couple of resources that are nonprofit organizations that you know, are associations of public health departments. They have some resources you might be able to use. But the data, you know, the data on hospitals is quite different from the data on public health departments. There's just not that much attention. It's much harder to come by. So, but it is, gosh, a really critical story. So I want to encourage you to ask your public health department what their plan is and whether they can do it. And then to wrap up, I'll just run through really quickly a list of additional resources. If you've ever been on a webinar with me, you know, at the end, I'm just like throwing links at you. Look at this. The first one is this list of statewide policies that some researchers at the University of Washington are tracking, which is interesting. As I mentioned, the Center for Health Journalism at USC has a whole bunch of webinars. You can view them. I highly recommend that. And also IRE has a bunch of webinars related to covering COVID, including fact checking and government accountability, and even covering education. So I'd highly recommend looking at those. Again, the Center for Health Journalism has this whole blog about the coronavirus files, which is some good reading. Oh. And there's one other thing. I would love to feel qualified enough to talk about this, but I don't know very much about this, but in one of those IRE webinars, Paul Overberg gave a short talk on WARN Act, which is an act that requires certain businesses to report intended layoffs. And I've linked his whole tip sheet here so that you can see what he says about the WARN Act and where you can look for that data. And again, as the economic toll of this pandemic continues to bear down on us, covering layoffs in the economy is going to be important as well. It's just not necessarily one of my strengths. I mentioned that story recipe that Jamie Fraser wrote for Open News, and I've linked here all of the articles that people have written. And I know that my colleague Hannah Recht is writing and publishing one of these this week, but this is a really good place to go. And I perused it before I did this webinar, to be honest. these people have written really good and interesting summaries of work that they've done, and also recipes for how you can do similar work in your area. So highly recommend taking a look at that. And then one final thing is Big Local News is a project between Stanford and Open News that has data sets curated and created by journalists. And I haven't spent a lot of time on it, but I wanted to put it in here because I think they're really trying to get a bunch of COVID-related data sets for journalists to use, and it's by journalists. It was co-founded by Cheryl Phillips, who's a longtime data reporter. So check it out, and I bet some of the data sets that I have mentioned in here are probably already in there, and maybe with some documentation. So it's a good resource. And with that, I will show you, this is the link to my presentation, which has all of my links in it, and we will open it up for questions.
Yeah, thank you so much, Liz. It's really a fabulous overview and so many story ideas embedded in it. We already have a bunch of questions, so I'll start asking some of them. And just want to remind folks that if you have a question, just go ahead and post it in the question field of the control panel. So I'm going to start out with a question, by Joanna Ramos, who says, what data is available about the primary language of people who've been diagnosed, hospitalized, and who have died? Given that race, ethnicity, and language data collection and reporting is sufficient, any advice? We're hearing here in Washington State that there are only racial and ethnic disparities in the impacts, but she wondered if there might be a higher percentage of people with limited English proficiency and how to gather that.
That's a great question. I have not seen any data that gathers primary language or language proficiency of actual cases. I'm sorry to say. So I guess if I were trying to report on that, that is information you can get from the Census Bureau. So, you know, you could look at if you got case counts or deaths in kind of a granular geographic way, like if you're in California and you can access case counts or case deaths by zip code, you could look to see if there are zip codes that have high percentages of cases or deaths, and also high percentage of people where English is a second language, which I believe is something you can get from the census. Now that wouldn't be, it would be sort of, you could infer that that's a factor that's affecting that area. However, that's also wrapped up with so many things. It's wrapped up with poverty and issues of access. So I think it would be really hard to draw conclusions that is causing there to be higher rates of cases and deaths. But I certainly think it's something you could bring into the conversation around what makes it so difficult for some people to survive during the pandemic. But yeah, in terms of getting the actual linkage, I think that would be hard to impossible. I'm sorry to say.
And we have a question from Vikas Shankar, who says there's a lot of information about how the African American population is disproportionately affected, but I haven't seen data that correlates that with poverty rates to determine if race really is an issue. Is there any source or news organization that has done this for various racial and ethnic groups?
I haven't seen a correlation, and again, I think there have been some sort of preliminary looks at that. There was one, again, out of New York City. Part of the problem here is that, we have had case counts by county and we have case counts by state. We sort of have case counts by zip code in some places. And it can be hard, income can be so variable, even just in a small geography. Like in a county, you can look at the median household income of a county, but there's a lot of disparity within that. So it's hard to correlate that with cases unless you have really granular data about where the COVID cases are. And then you have to say, well, are those, how many are we missing by people who are not getting tested? Again, the New York City data, for a long time, they were only testing people who are hospitalized. And those are certainly the most sick. So it's not like that's irresponsible, but I do think we don't have granular enough data to really get into how factors might be affecting these patients unless that information is collected, like race and ethnicity is starting to be. But nobody's, as far as I know, collecting the household income of people who have the disease. So it just makes it really hard to do that kind of analysis. Everything we know, though, about the social determinants of health tells us that people who are living in poverty or who have pre-existing health conditions are more likely to be affected and share an undue burden of a disease like this.
And Liz, just to make sure I'm understanding, because I think there's almost a question embedded in the question that we just got asked. I mean, we do know when we look at those denominators, for example, that African Americans are dying disproportionately, that it's more than just poverty, correct?
Well, we don't know. I mean, yeah, we do know that African Americans are dying at a disproportionate rate. And I think there's a lot of research we can rely on that says that is partly, I mean, it's very difficult to separate race and poverty. They're not, in some sense, they're distinct categories, but they're so interrelated. And so, I think it's important not to say it's just one or the other. I mean, they're interlinked for sure. But in terms of, again, just in terms of the data we have on actual cases, we don't know about people's socioeconomic status unless we know where they live or, some other information like that. Does that help?
Yeah, sure. And we have a question from Penelope Overton, who says, can you talk about covering outbreaks in corporate controlled settings, business settings like meatpacking plants?
Oh, yeah. Well, yeah, I mean, that's interesting because one of the reasons why the Missouri case counts have spiked is because we've had an outbreak in a meatpacking plant. And I believe there's a presidential executive order that says that meatpacking plants cannot close. The other thing I know about meatpacking plants is that you basically work shoulder to shoulder and touch all of the same stuff all the time. So that's a complicated question. It's very difficult to contain an outbreak in a place like that in any kind of factory setting, really, if somebody has it. And it is, I think, much like early on in the pandemic when that one nursing home, all of a sudden spiked and was the real driver of cases in Washington. We're going to see that more and more. However, it's also important to remember that those people are still going home and going out into their community and going to the grocery store. So just because there's been a spike in a meatpacking plant doesn't mean that that's contained. I think that is an interesting and important thing to watch because I think we're going to see more of that. I'm not sure if I answered your question, but.
Is there a way to get the data on that too by factory or?
Only by what's being reported locally. To my knowledge, there isn't anybody gathering it nationally. But I will say though, it's possible that somebody is and I don't know about it because I didn't know about the Washington Post gathering nursing home cases, until a week ago. And I think that's like a relatively new initiative. So hopefully, and I'm happy to look also afterwards and send it around, but I don't know of anybody who's gathering that at a national level.
So locally, they would have to release that. It's not like there's a database or something like that. Okay.
Yeah, it would just be whether they release it locally.
We have a question from Brenda Gazar. Is there any way to get demographic data of COVID cases and deaths in nursing homes?
I think the Washington Post data is only case counts. That's a good question. Again, I will say that might be something you can ask locally. I don't know of a data source that both identifies race and ethnicity and like the location of the transmission. But it might be something that, again, if you request that. So I'm thinking to Shelby County, actually. I think that they have both. I mean, they have all of that information. They have race and ethnicity, and they also have mode of transmission or place of transmission. But you probably have to make a special request to get them to cross it for you. I don't know of a data set that does that.
We have a couple of questions about efforts to get data from local jurisdictions on race and ethnicity. Cassandra Garabe says, how do you recommend going about gathering data about race and ethnicity if your local public health department will not share the data and says it is too statistically insignificant to share? And then Jolanda Gums says, our health officer won't give zip code information because she says there needs to be 5 cases for each zip code. What's the logic, and so on. And so I don't know, sometimes you can negotiate a contract and so on, but if there's a statistical question, maybe that's not a path forward.
I think, well, that's interesting. So they gather the race and ethnicity data, but they won't release it because it's not statistically significant. I mean, that's not a release.
It's a count, not a.
Yeah, that's not a reason not to release data. I only wonder if, and I think this is just unfortunately true in some places, they haven't gathered that information for enough cases. Because for some places, they just aren't collecting it. They're not writing, you know, when somebody goes to get tested or even gets hospitalized, they're not writing it down. It's astonishing actually how bad communication and data transmission is in some places. And so I maybe unfairly highlighted some of the good ones, but there are some really terrible ones where they just, it's not even, you know, in cases where they won't give you the data, there is kind of a standard suppression of a low number of cases by geography. You know, they're trying to protect the identity of the people who are sick, and that's understandable. And so if it is a really low number, it's reasonable for them to suppress it. But I do think also there's some places are just not doing a good job of data collection. Some places don't even have a digital system for collecting information. They fax papers back and forth between health departments. That in and of itself is a story. Like, that's a good story to write. If you can't get that information, write about how your public health department doesn't have it or won't release it. And try and dig into what kind of system they're using to communicate or collect information, because that in and of itself, like, this is information we should have to better understand this disease. And that failure of public health infrastructure is critical.
And is this an example where you could successfully negotiate to not reveal things that would provide information on who those 5 cases are? Sometimes that's the reason why a jurisdiction, when it's such a small number, they don't want to release the data.
Yeah, I mean, you could tell them that you won't identify patients, but that's also going to prevent you from then releasing that specific information. So if you just want it for reporting purposes, I mean, there are probably easier ways to find that information, but you're kind of, you know, you'd have to say that you wouldn't publish it or identify anybody out of the data. But yeah, I suppose there are instances where you could make those claims and that the data would still be worth something to you. So you could try that, yeah.
We have a question from David Gross, who says he's trying to find information from medical examiners and coroners regarding their plans for mass casualty management. Localities sometimes publish plans, but the plans are often missing or incomplete. sometimes just an incompleted template. Where can he find protocols and plans in localities?
I'm sorry to say, I don't think that there's probably not going to be another source of information. Again, that's just what I don't know of another source of information for that. That is a story in and of itself if they don't have a plan for mass casualties. You know, you could ask them if they, boy, yeah, I guess you could push them to give you what they have. Maybe they haven't released all of it. That to me, though, sounds like just another example of sort of letting things that we're supposed to keep up on slide, and you know, they may not even have a plan to give you if you ask for it. I don't know a source of information for that other than those local agencies, unfortunately.
And we have a question from John Perry, who says, in Georgia, they defined their hospitalization count as the, quote, count of confirmed cases in which the patient was hospitalized at the time of reporting, which is probably not what people are expecting it to be. Is that how other states define that number?
Oh, that is a good question. I suspect, no, that there's probably some variation on that. And that's a great plug for figuring out, for like reading the definitions and the documentations and talking to the source of your data. How do they define hospitalizations? My guess is that it is variable, but I don't know for sure.
Okay. And then just kind of looking through here, there's been a number of questions from somebody named Garth Gibson. Is it possible to get data for COVID by sexual orientation, or data to analyze why some locations are hotspots and others are not?
Sorry, what was the question?
The first part was, can you get data on COVID by sexual orientation? And the second question was, can you get data to analyze why some locations are hotspots and others are not?
On the first question, almost certainly no. It would be, you know, it would be a question of whether public agencies are collecting that information, and I would be very surprised if they are anywhere. I certainly have not heard of it. But in terms of hotspots, data on why one particular place is a hotspot and not another, you know, that's a hard question to answer. Like why are some nursing homes having 70 cases and others none at all? You know, why do some zip codes have high rates per 100,000 and others don't? I mean, some of that can be explained by social determinants of health that we've been talking about. And so, you know, you could look into those, but in terms of like a definitive answer of why, that sounds like a research question, but not something that data can just answer definitively, unfortunately. That's an interesting question, though.
We have a question from Sean. I'm not sure how to pronounce the last name. Dabru, can you talk about incomplete data reported by states, particularly Missouri?
Yeah, Missouri. Incomplete data reported by states. You know, for the most part, again, there's like some levels of reporting that are fairly trustworthy, and case counts and deaths are one of them. Although, again, I would caution that case counts depend on who's being tested, and deaths, again, also depend on who's being tested. Some states are testing people who have died and others are not. So if you didn't die in a hospital, is your state testing you or not? But when it comes to race or ethnicity or age or any other of those sort of granular questions we want to get at with COVID cases, in some, it depends in part on how your state's public health department is structured. what systems are in place for local or county public health departments to talk to each other and to talk to the state. Missouri is one of those places that the state does not take a very strong hand in organizing public health at the state level. And I also believe that the state of Missouri does not have like a digital system for communicating about case counts. California is another example. They have public health departments and local health departments, but they have no centralized structure. There's no way for them to naturally report up to the state. And so that's been a real hamper on timely reporting and consistent reporting. And then there are some states, like I believe Mississippi is one of them, where the health department in the state is very centralized, and so they're more likely to be communicating and having all that information communicated directly into the state. And so it all goes back to this question of like how public health is the vehicle for communication within communities and across the state. How is that structured in your state? How consistently are things being reported, and how much are these departments talking to each other? I think plays a huge role in how consistently and accurately and sufficiently stuff is being reported up at the state level. It's hard to answer that question broadly because public health is structured in so many different ways in so many different states.
Thank you. And we have a question from Christian Andrade, who says, do you have any comment on cross-referencing on public data with other sources? Do we trust the public data from the government versus journalism organizations versus some other sources?
That's a really good question. In other times, my answer is almost always go to government sources. But in this case, the journalism resources question, I think, is a good one. I tend to trust journalism resources, particularly from people that I know that do really rigorous work. I think one way you can sort of vet resources is by reading their methodology and their documentation. I would say that the New York Times is probably the go-to resource for case counts over the CDC. And part of that is just the CDC has been lackluster in its role as a central organizer and data disseminator, and some of that is changing a little bit. We also go to nonprofit organizations for data a lot, and it's a little bit riskier to do that. Nonprofit organizations like NACCHO and AASHTO have a stake. They have a particular viewpoint, and you want to make sure that you're not using data that carries that viewpoint unnecessarily. And some of that you can suss out by looking at their methods, figuring out how they collect their information. I often turn to some trusted researchers to see what sources of information they use, and they'll often tell me, well, you can use this data set for this information, but don't trust it for this information. But it's hard to know what the most reliable resources are. And even for the journalism organizations that are gathering data, most of them, I'm thinking of the ones that I've mentioned here, are pretty transparent about the shortcomings of their gatherings or where there might be inconsistencies. Like the Kovach Tracking project, for example, right, they're pretty transparent about states that are pretty bad at reporting. And so I think you have to do your kind of due diligence to see what the methods are behind each of those efforts. But and this is just true in this case, like those federal agencies are not the best source for a lot of this data right now.
We have a question from Natalia Megas, who says, a source told me her aunt died of a heart attack, but her death certificate said she died of COVID-19. How do you report on this?
That's a good question. How do you report on this? I would have thought it would be the other way around, actually. Somebody would have died of COVID-19 on their death certificate would have said heart attack. you know, the moral of that story is that death certificates they're kind of what we have, and we often use them to analyze death data, but death certificates they're very inconsistent. It's possible that if somebody died of a heart attack, that they were tested posthumously. That is happening in some places, and it should happen, truthfully. And so that's, you know, you could try and figure out if that were the case. But there are going to be a lot of comorbidities with COVID-19. And what gets reported on death certificates is going to be really variable, would be my guess, which is a hard thing to report on. You know, you could certainly talk to medical examiners and try and figure out what their MO is around that, and it's probably going to be different from different ones. But death certificates, yeah, it can be really tricky that way. Gosh, that's not a very good answer, but that's what I got.
Yeah, and a couple other questions here. I'm just going to try and go through them quickly because I know we're over a little bit. Another question on nursing homes. Can you get any demographic data on age, race, income levels, etc.?
I don't believe so, unfortunately. I don't even think you could get that on nursing home residents before COVID.
Mm-hmm.
You know, data on nursing homes, kind of the best resource we have for data on nursing homes is Nursing Home Compare. But that really doesn't get, you know, it can sort of get at how ill the population is, but it doesn't really get at demographics. I mean, that's come up a couple times now. I think that's a really interesting question, and I'm certainly going to look now to see if I can find any information on demographics by nursing homes, but I have not seen it.
Yeah. Elise Reuter says, do you have any advice on the best way to track enrollment in Medicaid and Marketplace plans since the pandemic started?
That's a good question. I think, well, on the Marketplace question, there's going to be a delay, and I don't know exactly when those new numbers are going to be reported out. That's going to be a great look back story, though, when that data is released. Again, that's for the federal marketplaces, when that enrollment data is released. I don't know exactly when that will be, but it'll probably be a few months out to see the increases there. And for Medicaid, it absolutely depends on what state you're dealing with. You know, I have a coworker who would be able to answer this question better than I can. I know, like in California for Medi-Cal, California is pretty good about releasing data on those enrollment numbers. And I think it's a little spottier for other states, although I bet there are national metrics that you could access. I just don't know what they are, but that's another thing. I'm happy to look up some of this stuff and try and get an answer back to you, because I think that's a really good story. I imagine that the increase in both Medicaid and Marketplace plans is going to be, well, Marketplace, if they're open, I guess that depends on the state, but for Medicaid particularly, I think that's going to be a really good story.
And I'll just mention to all the audience members here that we've launched a new feature on our website called You Asked, We Answered, where if you have questions, we try to find the right person who can answer it, and we'll include Liz's answer to this one there. But if you have other questions, you can send it to editor@centerforhealthjournalism.org, and we can try and get some answers for you. While you jot that down, Liz, kind of interesting question from Penelope Overton. Could you talk about the difference between those who die from COVID-19 and those who die with it? So from it versus with it. And she said, in Maine, we're getting daily updates on provisional deaths, but not on those who die from a heart attack or a stroke who may have it. How common is post-mortem testing?
That's a great question. I don't know how common it is. It probably really depends on where you are and varies widely. I doubt there's certainly not a national standard on whether you are testing posthumously, but everybody should be. With it or by it, you know, I don't know the answer to that. I don't know if there's actually a clinical difference between those two, and if there is that being translated into how death certificates are filled out or how things are reported? That's a fascinating question that I don't know the answer to. But my guess would be that it's, as with most things related to death, it's not consistent. There may not be a clinical difference, and it may just be a function of how things are reported as like primary cause of death, supporting cause of death. But boy, I'm putting that on my list too, because that's a great question.
And then I'm going to close with two international questions. Kahindi Adigboyega from Lagos asks how he could get data when he's just running into government agencies that are saying they don't have it. And Virushali Purandari says, many times tracking is not feasible, there may be errors, and how do you report on things like that?
Yeah, that's a good question. I don't do any international reporting. I know there are some good resources for international reporting, and what I'm going to do is point you to in my slideshow, in my slide deck, in the open news story recipes, there's a story in there by Sindhuja Rajnaran, and she has a list of resources for international reporting that I think is probably the best place I can point you. So that's the open news story recipes link. Sindhuja wrote up a story recipe that has some international resources, and I would look there.
Okay. Well, I think we're going to close. I really want to thank you, Liz. This has just been fabulous, so informative, and thank you for taking a little extra time to answer some questions. Thank you to our audience for joining us and for having such wonderful, thoughtful questions. We will be archiving this webinar at centerforhealthjournalism.org. Shortly, you'll be getting a survey asking you about this webinar and future ones, and we encourage you to fill that out. Lastly, this is all new content that we've launched around these weekly webinars, and should you want to support it, you can see the information here on how to do that, and we would greatly appreciate that. So thank you so much for joining us, and have a great day.